My dear students, I am Dr. Avijit Majumdar, Professor and Director of Noida Institute of Engineering and Technology Pharmacy Institute before you. Today we will be discussing about the motivation and prescribing habits of the physicians. In the previous classes, we have discussed in details about the process of market segmentation, followed by market targeting, and finally product positioning, where the companies make some mistake, what are the pitfalls of proper positioning due to which their product sometimes fails. Now today we are discussing mainly on the consumer profiling. Now the consumer profiling is an approach of describing a category of the consumer so that they can be grouped for the purpose of advertisement and marketing. A very similar approach to the process of study of consumer behavior followed by target marketing. So, consumer profile is an approach of describing a category of customers so that they can be grouped for the purpose of addressing the 4 P's of marketing mix and the advertising process. By target advertising to a specific group, the sales of the product increase, and once the sales of a product increase, automatically there is an increase in the profit. So our goals of profit maximization is satisfied. Now the customers or the consumers profiling can be recognized under the following categories. It may be in the basis of preference, it may be on the basis of the lifestyle they are using, it can be on the basis of the stage of life where they are, it may be a child, it may be a young individual, it may be an adult, it may be a senior citizen. So depending on the life stage where they are, we can categorize the customer according to it. We can, on the basis of the quality as well as the characteristics of the customers. Particularly whenever we are talking of the pharmaceutical sectors or the healthcare sector, our market mainly falls into 2 domains or 2 segments. One is as far as the patients are concerned, which we are calling as the patient level. Other one is for the doctor's level. Whenever we are segmenting on the basis of the patient, that classification depends on the patient, the people. See, it is the, as I have told you earlier, it's the people, the consumer, the customers who are segregated and isolated. So that patient with similar illness, they may fall under a particular therapeutic group. In fact, within a particular therapeutic group, so let us take the example of a disease called asthma. We can classify the patients on the basis of acute and chronic bronchial asthma. Whenever we are talking for patients who are suffering from hypertension, we can classify the patients whether he is a patient of mild hypertension, or he is a patient of moderate hypertension, or he is a patient of severe hypertension. That is the way we can classify. So, the main classification here is on the basis of the disease he or she is suffering from. And after classifying on the basis of the disease he or she is suffering from, we need to identify to which particular level of a particular disease he or she belongs to, because that will govern, that will guide the physicians to prescribe the medicines to that particular patient. That is, his consumption of drugs, his consumptions of medicines will depend on for which category they are. Next is analyzing the market at the physician or the doctor's level. Now, as far as the doctors are concerned, they can be classified on the basis of their age. Very senior doctors, doctors classified on moderate experience, and the doctors who are acting as an interns. So, doctors can be classified on the basis of age, they can be classified on the basis of specialty. Specialty means whether he is a doctor basically belonging to neurology, whether he is a doctor belonging to surgery, whether he is a doctor belonging to the field of gynecology, and so on. That is, depending on the specialty, we can categorize the physician. The purpose is the type of medicines which he or she will be recommending, that will depend on the specialization. So, if your company is preparing floating a drug mainly to treat the patient suffering from pregnancy, there is no meaning in wasting time by discussing with the neurologist. You should straight away go to the gynecologist who are dealing with the pregnant woman. Say you are preparing one surgical device, you are marketing one surgical device, and you are spending the entire time, you are wasting your entire time with doctors who are belonging to general medicine specialization. You will get a result, no doubt, but the degree of effectivity will be less. That is the reason why, depending on the category of your pharmaceutical product, you have to select the specialization of the doctors and address them. Doctors can also be classified where they are practicing, whether they are practicing in the urban area or in the rural area, whether they are practicing in government hospitals or in private nursing homes. So, depending on their place of practice, we can segregate the doctors. So, doctors can be segregated as per their age, the doctors can be classified as per their age, the specialization, and the places where to practice. Now, what are the factors which affect the pharmaceutical market size? Because all of you, most of you will be working in the pharmaceutical sector. The factors which affects are the prevalence of the disease, which is again related to the population size, the age, the genetic inheritance, and the behavior. Another category is the affordability. which is again indirectly related to the income, but definitely it is related to the price of the drug. Next is consumer attitude, which includes the willingness to use alternative therapies. The fourth factor which affect the pharmaceutical market size is the government policies, which affect the reimbursement and who the payer is. Insurance companies are now flooding the healthcare sector. Other government policies determine the regulations. This is another way by which the pharmaceutical market is affected. And a major supply side factor is the availability of the appropriate treatment, which may be a matter of quantity, particularly during the epidemic area. So, the criteria for a viable segment will be measurability, accessibility, desirability, homogeneity, and vulnerability. These are the five criteria for a viable segment. Now, if this is the scenario of the healthcare sector, we need to satisfy the customers. Now, as far as the pharmaceutical drug sector is concerned, who are the decision maker regarding which drug to purchase, which drug to consume? Obviously, it is the doctors. It is the physicians or the doctors who take a decision which product a patient will take, which brand a patient will take, which generic group of drugs a patient will take, because they are having the power of prescribing. Prescribing drugs requires appropriate knowledge, skills, and professional judgment, and they are beneficial to the patient, implicitly to their health. And whenever you are visiting the physicians, you have to highlight the therapeutic benefits of your product. You need to highlight that your product is having a lesser side effect as compared to the product of other competitors. Your final objective is the patient must be motivated, the patient must be geared up to recommend your brand when they are treating the patients. Then and then only your brand sales will increase and you will achieve the process of profit maximization. Let us discuss what are the various steps of drug prescription process. Number 1, to evaluate and clearly diagnose the problem of the patient. This is very important. More is the experience, better is the process of the evaluation and the diagnosis process. Once the disease has been diagnosed, you have to specify the therapeutic objectives. Once the therapeutic objectives are specified, you have to go for what we are calling as selecting the drug therapy. Now, whenever, in fact, this is a very important step, because this is the step where the doctors will prescribing your brand. The doctors will prescribe your medicines. And during the process of prescribing, they may indicate the therapy along with the other appropriate details with non-pharmacological aspects also. Non-pharmacological aspects: what food to take, what food not to take, all other non-drug related aspects they need to explain to the patients. The next step is giving information to the patients related to the warnings of drug therapy. You need to explain to the patients whether they have to take it on an empty stomach, whether they have to take it with meals, what is the frequency of dose administration, everything you have to explain to the patients. After that, the last step comes for the follow-up. That is, you need to evaluate the therapy regularly and monitor the treatment results. If the treatment is not proper, if there are certain side effects, adverse effect, you need to go for discontinuation of the drug. Factors influencing the behavior of prescription of medicines by the physician. Number one, this includes what are the factors which a patient consider, or a physician consider whenever he or she is recommending a drug. Number one, the foremost important is the quality of the product. A very important aspect, because the reputation of the physician depends on this quality of the product. Because if the quality is good, if the patient recovers, the reputation of the physician improves, increases. Next is whether the product is available. The physician will see whether it is a product available in the nearby retail outlets. So, for example, if he is writing a prescription and frequently the patients are reporting that they are not getting that product, automatically a time will come when the doctors will stop writing that particular drug. In fact, that is the reason why availability of product is very important. You have to see that your product is available at all the retail outlets nearby. The third important factor is the image of the company. Which company's product he or she is writing. The brand image. Next is the regular visits of the representative of the product company. Whenever you are going to the doctor, you are showing them with your laptop the salient important features of your product. And whenever you are showing the salient important product of your product, there are a large number of situations where you are providing them with leaflets, with smaller booklets, mainly given in the pictorial form, specific literatures. Apart from displaying your product, you need to motivate the doctors by providing them certain free samples. You need to highlight the existence of various websites of the pharma producers so that the doctors in their leisure time, in their free time, can go for surfing the net to search about your product. If your product is a newer one, that also you need to highlight. Apart from these non-financial ways, you have to sponsor the doctors in various conferences. Sometimes you have to produce or provide certain gifts to motivate the doctors. So, the motivation, let me explain the motivation concept, a very important area. It is the process that guides and maintains the goal-oriented behavior. Motivation is affected by perception, attitude, personality traits, and your marketing efforts. You need to stimulate, you need to rejuvenate the doctors about your product. There are three models. One, Maslow's need hierarchy model. This is the most important one, so I will be discussing this in our class today. Apart from it, there are Hajbach two-factor theory. There are carrot and stick model of motivation. Now, carrot and stick is nothing but it is a process of reward, stick means punishment. It suggests that you need to have a combination of both rewards and punishment in order to motivate a group of individuals. That is the reason why it is called a science. Management was a science. Now the question is how far you will be adopting the carrot, how far you will be giving him punishment. That depends on the manager himself. That is the reason why I have told you earlier that management is both science as well as an art. Now let me explain the Maslow's need hierarchy. Basically, it is like a pyramid. Maslow suggests that an individual, irrespective of their age, the first is the physiological need. Physiological need means the need for food, the need for water. Next is the safety needs. Everyone wants to be safe. The security for body, employment, resources, morality, family, health and property. Next is the social need. Everyone wants to love and to be loved. That is called the social need. Next is the esteem need. The confidence, the achievement, respect for yours, respect for others. They are all coming under the esteem need. And finally is the need for self-actualization. And please remember that unless the lowest level need is satisfied, the next level need will never come. First physiological need will be satisfied, then and then only the need for safety, social, self-esteem, actualization, everything will come later on. So the physiological need, that is the requirement for human survival. If it is not met, people cannot survive. It is the need for water, air, food, rest. After this need is satisfied, we will go for the next need, that is the safety need. Everyone wants to be safe. Safe means they should have a house to reside. They should have personal safety, including the emotional one. Everyone wants to be physically safe, healthy. Next is the social need. Everyone needs to be loved, to love and to be loved. Everyone, even if it is a child who has newly born, a people of around 15 to 20 years, an adult of around 30 years, 40 years, 50 years, even a senior citizen. Everyone wants that he should be loved, and he also wants to love somewhere. He wants to love someone. He wants to be loved by a group of people. Affection, a situation of a bondage. Social need to love and to be loved, need to feel a sense of belonging and acceptance. There may be a small groups in clubs, in office, in teams, schools, colleges. Sometimes nowadays they are in larger groups, political parties, sports teams, Facebook, Twitter and so on. Next is the esteem need. Need to be respected by others. In turn, they also want others to respect them. A sense of contribution to feel self-valued. It may be either in a profession or in a hobby. higher self-respect, the need for strength, competence, mastery, self-confidence, independence and freedom. The last one is the self-actualization need. What a man can be, he must be. A sort of a growth motivated rather than deficiency motivated. He wants, let's say for example, he is climbing a ladder. So everyone should acknowledge his capacity to climb up a ladder. Say for example, a child is drowned in a small pond or a river. Somebody is jumping to save him up. So he should be acknowledged, his effort should be acknowledged by the group of people. So Maslow's product in theory, products are formed and placed to satisfy a category of needs in marketing as well as advertisement. Pens, pads, medical books and journals, financial assistance for travel, sponsorship for academic level. Now whenever we are choosing a physicians, we take into account the characteristics of the physician in terms of age, gender, qualification, specialization. We also look after the technical and interpersonal skills of the doctor. We see about the emotional and cognitive response, mainly focusing on the experience. Patient choice for retailers and pharmacists, who are the bridge between the doctors and the patients. The retail pharmacists are responsible for dispensing and controlling prescription and non-prescription medicine. Pharmacist checks the medicine and amount prescribed by the doctors. He will highlight whether there are any side effects and educate the patients of how to take the medicine. The main objective is patient should get the maximum benefits for all medicines. Now the following slides will have some good prescription habit. The handwriting should be good. They should not use abbreviations which are not standardized. They should make the line very clear. These are some of the good prescription habits. So for example, they should mention the units very clearly and not write like 500 what they have mentioned here. They should not use unstandardized one like you. They should mention the entire word unit. Whenever they are prescribing a dosage form, they should mention the subcutaneous or sublingual and so on. They should mention, the doctors should mention during the prescription process the time they should come for a process of re-evaluation. The scribbling should be avoided. The handwriting must be very clear. You know, there are certain situations that they are not, the doctors are not looking into account the medicines which they are taking in the past. So self-medication should be avoided. Skipping negative medication history in good faith. Mention all the things negative about the patients, like not taking the prescribed medicines, not taking the medicines on time, skipping at on certain occasions. They are there. Writing the referred name of the doctors clearly on the prescription. That is one of the most important parameters which we should see. With this, we are coming to the end of the class today. Thank you all of you for your patient hearing. And today we are coming to the end of unit number 1 of the subject of pharmaceutical marketing management. Thank you.